Hey guys, welcome to Mom Talks. It is Friday at 11 o'clock, so you know where we are. I'm Laura, your host today. This is Dr. Hefkin, a pediatric gynecologist, and we are wrapping up our teen series this week talking about girls and their reproductive health. What are we supposed to do? When are we supposed to do it? So thank you so much for joining us.
Thanks for having me.
This is a great time to talk about it. So I think one of the questions, this topic actually came to us from when we very first started this series about what should we talk about, and reproductive health was one of them. So I'm so glad we get to touch on this. I think one of the questions that we got was, when do you start this process? When do you know when it's time to take your daughter to a gynecologist?
Yeah, I think that's a great question. It's a question that we get often. And actually, gynecologists in general have a governing body, the American College of Obstetrics and Gynecologists, and they put out a recommendation that there really should be an initial visit with a gynecologist sometime between 13 and 15 years old.
Okay,
right?
so those early teens.
Yeah, those kind of early teens. But I think that can be confusing to say, well, what exactly are you going to do then, right? And it's really just this idea of kind of getting a comfort level and, sort of demystifying this experience of going to the gynecologist, right? So
people could be self-conscious about it and not understanding really what's going to happen.
And don't Google it.
Don't
noted. Don't Google going to the gynecologist, because the idea would be that you would just come to the gynecologist, sort of get an idea of what is the experience, who is the staff, right?
Making sure you're comfortable.
Making sure you're comfortable, right? And it would be more of an educational experience than it is really, doing tests or, having a true diagnosis. It's just, let's learn a little bit about your body and what, we need to know about being a female and what a gynecologist is and does, more than it is, a really large experience.
Age ranges of 13 to 15, is that because changes are happening then, the milestones are happening then, or it's just that's the most common time and that's when people need to at least start?
I think it's a lot of that. It's a lot of that, right? So, the idea is that most girls on average will start their periods around 12 years of age, right? And, if we're not starting our period by that 13 to 15-year-old mark, we want to kind of learn about that.
Okay, so it's, before and the, if you are or if you're not.
That time. So our goals in that period is to make sure that we kind of learn about the girls and let girls learn about us. And what you would expect in that visit is that we would usually, kind of just like you would at your general pediatrician, you would come in, do vital signs. We talk a little bit about your past medical history and surgical history, those type of things. And then we would usually talk to the girl and their parent together first.
Okay, so everyone's in the room together.
Everyone's in the room first. Everyone gets to keep their clothes on. Okay.
Always nice.
Yeah. And then we'd have a little discussion about, have you started your periods and, what are those periods like?
Yeah.
Okay. And then we just give an idea of how is this visit going to go, right? And I think the biggest concerns most people have is, what are we going to do as far as an exam, right? And that is just really dependent a lot on the individual person who comes to see us, right? Because in general, every 13 to 15-year-old is not the same, right?
Shocking.
Everybody is a little bit different as far as how they are growing and developing on a personal level, right? And how they feel cognitively, right? Everybody's a little bit different in their maturity level, okay? And then everybody has different experiences as far as their sort of, social experiences and how they are medically with their periods and things like that, right? So we can talk at that point to say, even if we were going to do an exam, it could just be a general physical exam, right? Looking at your belly and your back and those type of things. If we did do a more personal exam, sometimes it might just be looking at the breasts and the development, right?
Yeah.
If a genital exam was done, that is mostly just looking at the outside. Okay. We wouldn't bring out the speculum, right? That is
up close and personal.
Yeah, that is really hardly ever warranted at that first pelvic exam, right? The age that we would do a pap smear in
because I think
girls
people
now,
put those two
you
things
put
together
those things
very
together, right? You think the gynecologist is where you get your pap smear, right? And a lot of people don't necessarily separate a pap smear from a pelvic exam, right?
Okay.
You kind of always think, well, those are
they
the
go
same
hand in hand,
thing,
but they
right?
don't.
But they don't, and they're very different. The pap smear is when you're actually testing for abnormal cells on the cervix to see if you're at risk for cancer. Okay. You don't need that until you're 21 years old.
Okay.
No matter what, hard stop, whether girls are having intimate relationships or not, whether they're having normal periods or abnormal periods, it doesn't matter.
PAP is not required.
And it's very different than what happened when we were kids, right?
Yeah.
Or when we were younger, it used to be very dependent and it used to start earlier.
Absolutely.
So that is kind of changing some differences for a lot of us, you know, who may have started those things earlier. Okay, so that is something that is just a lot of changing thought processes that as parents we might have been like, well, when I was younger, I started getting these exams when I was 15, so if you go to the gynecologist, this is what's going to happen. So it's a bit of a conversation to say we actually would not necessarily have to do that. Okay. And in almost all cases we don't.
Okay. So I guess one question I would have too is how do you, so other than their age, do you have to get referred to a gynecologist? Do you have to have your period first, or do you have to have an issue going on when you go to your pediatrician to ask, like, okay, now what do we do? Or do you just come as you need to?
Yeah, and I think that is variable from person to person, right? You definitely do not have to have a referral to come see us. So if you know, if a parent and their daughter are talking and they say, you know, I think it would be good, you know, we've talked about this and just having a conversation about my body and the changes that's going on and my periods and just going through puberty, it would be nice to have that conversation with the gynecologist and get to know them. You can just call our office and we can have that discussion, right? However, many people have a pediatrician who is very comfortable with those types of discussions and has been having those conversations over time, but then may get to a point where they say, well, you know, this would be a time where I would, you know, move you on to a referral with a gynecologist because we've kind of reached the point where I am at my comfort level, and then we would have a referral from that. So I think it's a little bit dependent on that. And one other thing I wanted to say with the exams, right? I think one thing that we do like to do in those sort of initial exams when we do the external exams that I think is very it's very rewarding for many patients, even though they're kind of timid to do that in the beginning, right? Is we like to do what we call a teaching exam.
Okay.
So that would involve an external exam of the genital area, right? Where we would have the patients look with a mirror at the same time that we are doing the genital exam. Okay. And we're basically just teaching them what are the parts of the vaginal area, how do you clean and take care of that area properly. Education. Just a real educational experience about what are the places, what has changed when I went through puberty, right? How do I make sure that I am taking care of the area properly, right? And really a lot of patients do very well with that when you think that they might be more uncomfortable with it. And a lot of moms actually leave saying, you know, I really wish someone would have done this when I was younger. If this would have been available, so many things might have been easier, right? So I think those are a lot of things that we could do in an initial gynecology exam that kind of help you throughout the rest of time, where you might not have to come back and see us later, because just learning some of those tips and tricks in the beginning can help you from having things like vaginal discharge or itching and irritation that may have just been due to not having the experience or the knowledge. Right?
Got it. Yeah. So I think one thing, and by all means, if there are questions, please feel free to let us know, because you know, I have little boys, so I'm going with what you guys want us to talk about. So let us know if you've got any questions. I think, you know, we've talked a lot about periods. When your daughter gets her first period, what are we supposed to do as parents, and how can we help them through that and make sure they're maybe having healthy periods, or what does a healthy period look like?
Yeah, exactly. So I think a big thing is just making sure with those initial periods that we've kind of had that conversation leading up to
before it happens.
Because I think a lot of times Just thinking back on all of us to our first periods, right? If no one had ever mentioned to you before that it was coming, that can be very frightening, right? So I think as parents and ourselves, just make sure that earlier we start having conversations about the changes of puberty and expecting that menstrual cycles might come, even when girls are at the very younger ages, right? Our 4, 5, 6-year-old patients, just don't feel afraid to just have those age-appropriate conversations as they come up. When girls ask questions about their development, just answer them honestly in that age-appropriate way, right? And that way, when it starts getting to the harder things, it'll be easier.
Well, and then if they ask the questions, and you're like, honestly, I don't know. Or, you know what, I don't want to have this conversation. Let's go talk to your doctor. And that maybe will help them in that confidence. And they're allowed to have questions.
Yeah, because there is a variable amount of girls who come to our office where we have conversations, and we kind of sometimes have to step back to say, okay, well, now let's step back and talk about what a vagina is before we can talk about what's happening with it, right? But to your question about periods, right? I think the one things we need to kind of understand is that when periods start, they can be very variable, okay? So in that first 2 years to sometimes even a little bit more after periods start, we expect that they're not going to look like what mom's periods look like, right? We don't expect them to come every 28 days on the dot, following the menstrual calendar like we expect. Most of the time they should, though, have some bit of regularity to the irregularity, right? Usually within 21 to 45 days, we would expect to see that. What happens sometimes is we know that girls should have irregular periods in the beginning, and then we kind of say, well, anything can go, right? So we do make some ground rules, right? I think something that's helpful is to use what we call the 1-10-20 rule, right?
1-10-20.
1-10-20.
1-10-20.
Okay, to say if you're using more than a pad an hour, so that's the one.
Okay.
If they are closer together than 10 days, or if you are going more than 20 days, if you're going more than 10 days. Or if they're closer together than 20 days.
Got it.
Then we're worried you're having too much bleeding, right? That your periods are too heavy or that you're having too much bleeding. You might be at risk that the blood count might be getting low, right? We would want to hear about that.
1-10-20.
1-10-20.
Very helpful information.
And then on the other end, if you're going more than 90 days without a period. Okay, that's too far apart. That's the other extreme.
What's that, 3 months? 3 months is too long.
Yeah, then we would want to hear from you about those things too. So those are just some easy tips and tricks to say if those are going on, it would be a good time to call.
And those are good open conversations. And I think we have a question.
What if my daughter starts her period at school? Is there something I can do to prepare her?
Candy. Lots of candy. I guess that is a good question of making sure if your kiddos are this age, talking to your school nurse even about what's available to them. If they have lockers, I would think keeping kind of those care packages, just to have in their backpacks.
I think from a personal level, as someone who did accidentally start their period at school in white shorts with very little
that's the nightmare. That's the nightmare.
It's the nightmare, right? I'm very sentimental to this, and so the conversations that I kind of have with girls is it always feels, especially to our younger patients who are starting their periods maybe younger than 12 or on that lower end, they all feel that no one else is having their period, right? Because no one's talking about it, right? When we're adults or later teenagers, right, people talk about their period like they talk about going to dinner, right? We're just, who needs a tampon? And everyone can pass them around, right? And so I think it is making sure that they realize, you are very likely not the only one having your period. It's just that no one is comfortable.
It's almost more emotional care at that point than it is like, here is stuff you need. It's almost the emotional prep of it. And
so, I think it's just making sure that they do kind of know that it might be coming. And if that does happen, to say, your teachers and the nurse should be accustomed to this. And that, asking to be able to leave the room to use pads and tampons should be something that all schools allow, okay? And if they're having problems where they're having heavier periods and overflow at school, or they're not able to maintain that at school, then that is where we can come in and help.
Breaking that
right?
1 hour or the 1 pad rule.
Yeah, or even if you're not breaking that rule, but it's causing interference on their daily life, right? Because there's kind of no magic time frame where we say, this is a time that we can help with periods, right? We use that 1-10-20 rule to say that's where you really should call us, because we're worried that it might interfere with the health of your daughter. But the other thing we say is, we don't want periods to interfere with girls going to school or being effective at school, right? Because we want our daughters to be the leaders of the future, right? And you can't do that if you're worried more about your period than you are with focusing at school, right? And so that's when we can help if those are problems, and say, you know, we can talk about just educating, or we can talk about medical management of periods.
Excellent. Perfect question. I think we have another one.
How important is the HPV vaccine?
Oh, that's a good one.
Wonderful question. Wonderful question.
Because this kind of relates to our teenage boys as well, right?
Absolutely. So I am 100% pro HPV vaccine, okay? HPV, first of all, for anyone who doesn't know, HPV is a virus that can be related and is related to any anogenital type of cancers, right? So it can cause cancers of the cervix, the vagina, the anal region, and in boys, penile cancers, but also can cause cancers of sort of the throat area, and then genital warts. And there has been a vaccine available to help prevent HPV for some time. But the uptake of the HPV vaccine in the United States is much less than we would like. Only about 40% of girls are getting the HPV vaccine.
Because is it relatively new? Is it maybe that some of it just
compared to other vaccines, it's relatively new, but it's been around for a good amount of time. I could probably do it by my age, because I know that when it came out, I was 1 year too old.
There you go.
So we won't maybe time myself. And in boys, it's about 28% who are getting it. So we would like to see that number to be a lot higher, right? But if we could increase those numbers, so if we could increase that to 80%, then we would see probably about 5,000 less women a year getting cervical cancer. So it's really important if we could.
And so we get this vaccine in their teenage years.
Right, so it is approved for 9-year-olds up to 26-year-olds from the CDC, but it's recently been FDA approved for up to 45-year-olds. But the goal where most boys and girls are getting it is around 11 to 12 years old.
And so do you go to your pediatrician for something like that? Is those questions you should take to them, or is this something they come to?
So most boys and girls will get it through their pediatrician, but many gynecologists will also offer it. And if you didn't get it in that 11 to 12-year-old time, then gynecologists will give it kind of as a catch-up vaccine, right? So we do offer it in our office, but majority of people will get it through their pediatrician or their primary care physician. So please talk in both of those. It has been found to be a very safe vaccine, right? Mostly just an injection site reaction. Initially, when we were giving the vaccine, there were some girls who were getting it feeling a little dizzy and lightheaded when they first got it. So we just keep girls in our office, a little bit after vaccine, just to make sure. But that's actually improved with time, with making sure that girls are hydrated and stuff when they get the vaccine, right? Yeah.
Excellent question. Well, I think that's all I have. But anything we didn't touch on that you would just kick yourself later if I don't talk about it?
Yeah, I think other things to kind of talk about when you are talking about your teenagers and your young adolescent patients about coming to see the gynecologist is just having an expectation that when you come see us, that we will want to talk a lot about having some confidential time with your young teenagers, and that is really important, I think, as we continue talking to patients moving forward, just because we found that having that time for them to gain a really, truly sort of growing as an adult, right? And having some of that private time to just feel that they can start to trust in their physician, right? is really important.
That seems like a good conversation to almost have in the car, almost on the way there, of like, hey, by the way, I'm going to step out at one point, and you're supposed to talk to this doctor. You're supposed to tell them things.
Yeah. And we would...
If you don't want to tell me.
Right, if you don't want to tell me. And we would hope that that is starting to grow in the world of your primary care doctor, but it definitely would be something that occurs. So usually what happens is we talk together as a family, and everyone is together.
Yeah.
Then we would talk to the girls by themselves for a few minutes, right? And then everyone comes back together at the end, kind of as a wrap-up.
Got it.
Right? And then also we put a lot of autonomy onto the girls to kind of be the ones who are the decision makers during the visit, right? So if there's going to be an exam, we'll usually ask them, right?
Yeah.
Obviously, do you want to have the exam, and what parts of the exam do you want to be? Making sure they
what
know
questions you
this
have.
is your body, you are the one who is in charge today.
Absolutely.
And then also, who do you want to be in the room when we do the exam, right? And it's very different from girl to girl, right? Some are like, oh, I need to have mom in here holding my hand.
Do not
and
leave
being
me.
With me, right? And many girls are like, no, this is me, and this is my private space, and I'm gonna do this by myself, right?
Yeah.
So I think also as parents and as teenagers to say, just making sure that we're kind of first guiding our children through that, because we know our kids, right? And you would probably know, okay, I'm gonna have that daughter that is going to be like, I'm on my own and I'm ready to do that, or and I'm probably they're going to want me to be there, and just kind of helping them through that process of gaining some of that independence and knowledge.
I feel like that almost pulls together our whole discussion of teens over this last month of it's going to vary by them, and you're going to know your kiddo best, but help them through it and just help guide them through it, because they're going to do it on their own. You want them to do it on their own, but you can still have that hand in through the process.
Yeah, and then just knowing that during that confidential discussion, right, we will have conversations about relationships, and we will be asking them some of those things I think that you guys discussed last week, right, as far as safety, and are there questions or things that they have about, you know, safety at school, or some of those things as far as drugs and alcohol that we need to discuss, right? And those are things that I think are important for teens to feel that they can talk about in a private setting, but also knowing that decisions are always something that we ask them to have together if possible.
Yeah, instilling that responsibility.
Right.
That's so helpful. Thank you so much. I have a feeling we're going to do a whole nother set of teen stories, because this has been a great series and so helpful and informative. Thank you guys so much for tuning in this week. Next week, I start a whole new series. I think it's a 5-week series about kids and sports. I am a sports mom. I am a soccer mom. I don't even want to admit how much sporting equipment is probably sitting in the back of my minivan right now. So we are going to be talking to a lot of our orthopedic team about stress fractures and emotional health of our athletes. If they're good winners or good losers, how do we help those conversations? Also injury prevention. So we're going to have a lot of fun in the next coming weeks. But thank you all again for tuning in, and we will see you next Friday at 11 o'clock.